Hey there, fellow knowledge seekers. Ever find yourself wondering, could I actually save a life?
Hmm.
Well, today we're diving deep into a topic that could empower you to do just that.
Yeah.
Cardiopulmonary resuscitation,
Mm-hmm.
better known as CPR.
Right.
We're going to unpack some incredible educational material
Okay.
provided by London HeartbeatsZ Academy, UK.
Oh, wow.
Big thanks to them. And don't forget to hit that subscribe button on our Facebook,
Yeah.
Instagram, Spotify, and YouTube channels to catch all our future deep dives.
Cool.
You won't want to miss them. Okay, let's get started.
All right.
What makes CPR so crucial,
Okay.
and where do we even begin with something this important?
Well, CPR is all about those moments when
Yeah.
every second counts. It's a lifeline when someone's heart suddenly stops beating,
Oh, wow.
a way to keep blood flowing and buy precious time until professional help arrives.
Okay.
And the best part,
Yeah,
you don't need a medical degree to make a difference.
that's reassuring. I have this document from HeartbeatsZ Academy in front of me,
Mm-hmm.
and the first thing that jumps out is the definition of CPR itself.
Right.
It's described as an attempt to restore spontaneous circulation.
Oh.
So we're essentially trying to get the heart beating on its own again.
Exactly.
Okay.
It's about mimicking the heart's pumping action
Yeah.
to keep blood flowing to the brain and other vital organs.
Mhm.
Now, the document highlights a crucial point.
Okay.
CPR is most effective
Yeah.
when performed immediately after a sudden cardiac arrest.
Sudden cardiac arrest.
Yeah.
That sounds terrifying.
Yeah.
What exactly does it mean?
It means the heart's mechanical function has abruptly stopped.
Okay.
But here's the key.
Yeah.
It's not always the end. In many cases, it can be reversible, especially with swift action.
So CPR isn't just about keeping someone alive.
Right.
It's about potentially reversing the cardiac arrest altogether.
Precisely. And that's where those first few minutes are absolutely critical.
Yeah.
The document goes on to mention different types of cardiac arrest. Ventricular fibrillation, asystole, pulseless electrical activity.
Okay.
What are your initial thoughts on this?
Well, I knew about ventricular fibrillation,
Mhm.
where the heart's rhythm goes haywire.
Right.
But these other types, like asystole,
Yeah.
which I think means a flatlining of the heart's electrical activity,
Right.
those are new to me.
It's amazing how much we've learned
Yeah.
about the different ways cardiac arrest can manifest. And this knowledge is crucial
Okay.
because the type of cardiac arrest
Yeah.
dictates the most effective treatment approach.
Yeah, it makes sense.
Yeah.
So it's not a one-size-fits-all situation.
Right.
We need to understand the nuances to provide the right intervention.
Absolutely. Now, the document then delves into two main levels of care.
Oh.
Basic life support, or BLS, and advanced cardiac life support, or ACLS.
Got it.
What jumps out at you when you compare these two approaches?
Well, BLS seems to be the foundation, focusing on the essentials:
Right.
circulation, airway, and breathing.
Yeah.
The classic ABCs.
Yes. But with a modern twist,
Okay.
the latest guidelines actually emphasize CAB,
All right.
circulation, airway, breathing,
Interesting.
to prioritize those chest compressions and get blood flowing as quickly as possible.
So we start with compressions before even checking the airway.
Right.
That's interesting. Why the shift?
Because research has shown that restoring circulation is often the most critical factor
Okay.
in successful resuscitation.
Right.
Every second counts.
Yeah,
So we want to get that blood pumping as soon as possible.
that makes sense.
Yeah,
It's all about maximizing those precious first minutes.
exactly.
Now, ACLS seems to build upon BLS,
Mm-hmm.
involving more complex procedures like intubation and medication administration.
Yeah.
Is this something only healthcare professionals handle?
Generally, yes. But
Okay.
ACLS requires specialized training and equipment.
Right.
It's about providing additional life-saving interventions beyond the basics of CPR.
I see.
Mhm.
So BLS is what bystanders like us can do to make a difference,
Exactly.
while ACLS is the next level of care provided by medical professionals.
Exactly. And that brings us to a crucial concept outlined in the document,
All right.
the chain of survival.
Yeah.
It's a powerful framework
Mhm.
that emphasizes the interconnected steps
Right.
that increase the chances of surviving sudden cardiac arrest.
Okay.
If you're enjoying this deep dive into CPR,
Yeah.
remember to subscribe to our channels for more insights like this.
Got it.
You can find us on Facebook, Instagram, Spotify, and YouTube.
The chain of survival.
Yeah.
I've never seen posters about that.
Mhm.
What are the key links in this chain?
The document highlights 4 crucial steps. early recognition and calling for help, early CPR,
Right.
early defibrillation,
Okay.
and post-resuscitation care.
So it's a sequence of actions,
Right.
each
Both.
building upon the previous one.
Precisely. Early recognition and calling for help set everything in motion.
Yeah.
Early CPR buys time by manually circulating blood. Early defibrillation, if appropriate, can reset the heart's rhythm.
All right.
And post-resuscitation care focuses on stabilizing the patient
Yeah.
and minimizing further damage.
Like a well-coordinated relay race.
Exactly.
With each link crucial to reaching the finish line.
Yeah.
And this document seems to break down each of these steps in detail, providing clear guidance on what to do in those critical moments.
It does. And that's what we'll be exploring in this deep dive.
Okay.
We'll unpack each link in the chain of survival so you feel empowered to act if you ever need to.
That's amazing. I'm already feeling more confident just hearing you explain it.
Oh, good.
Okay, so let's start with the first link.
Okay.
Recognizing sudden cardiac arrest. What are the telltale signs that someone might be experiencing this?
The document highlights two key signs:
Okay.
unresponsiveness and abnormal breathing.
Unresponsiveness, meaning they don't react when you try to wake them up.
Yeah.
And abnormal breathing could be anything from gasping to no breathing at all.
Exactly. If someone's not responding to gentle tapping
Yeah.
and their breathing is absent or irregular,
Right.
those are major red flags.
Hey.
It's time to act fast.
Okay, so we've recognized the problem.
Right.
What's the next step in the chain of survival?
Activating the emergency response system.
Got it.
Call for help immediately. And make sure someone locates a defibrillator if available.
Right.
Those precious minutes can make all the difference.
Got it.
Call for help and find a defibrillator. Then what?
Yeah.
Then we check for a pulse.
Okay.
The document recommends checking the carotid or femoral pulse for no more than 10 seconds.
Okay.
If there's no pulse, it's time to begin chest compressions.
Okay, let's talk about chest compressions.
Okay.
This is where things get hands-on, right?
Yeah.
The document gets pretty specific about hand placement and technique. Why is that so important?
Because proper technique
Yeah.
maximizes the effectiveness of those compressions.
Okay.
We want to ensure we're generating enough force to circulate blood effectively.
So it's not just about pushing on the chest, it's about pushing in the right way.
Absolutely. The document describes the correct procedure.
Okay.
Lay the person on a hard surface, kneel beside them.
Right.
Place the heel of one hand on the lower half of their chest,
Yeah.
right between the nipples,
Okay.
and interlock your fingers.
Got it.
Keep your arms straight with elbows locked, and use your body weight to push down.
It almost sounds like I'm giving the chest a firm hug with the heel of my hand.
Yeah,
Is that about right?
you've got it. And the document emphasizes pushing down about 2 inches for adults
Okay.
and allowing the chest to fully recoil between compressions.
Recoil. Why is that important?
That recoil allows the heart to refill with blood
Okay.
before the next compression.
Yeah.
It's like squeezing a sponge. You need to let it expand again to soak up more water.
Okay, that makes sense.
Yeah.
So push hard, push fast, and let the chest come back up fully between compressions.
Exactly.
Anything else I should keep in mind?
Yes. The document recommends a compression rate of at least 100 per minute.
Okay.
Think of it like the beat of a fast song. Maintaining that rhythm ensures consistent blood flow.
Okay.
Don't forget to subscribe to our channels,
Got it.
Facebook, Instagram, Spotify, and YouTube, so you can catch the rest of this CPR discussion.
Right.
We've got a lot more ground to cover.
100 compressions per minute.
Yeah.
That sounds pretty intense.
Yeah.
And do we just keep doing compressions until help arrives?
Right.
What about breathing?
We do incorporate rescue breaths,
Okay.
but the ratio has shifted in recent guidelines. We now aim for 30 compressions followed by 2 rescue breaths.
Okay.
This balance ensures we're both circulating blood
Yep.
and delivering oxygen.
Interesting.
Yeah.
So 30 compressions, 2 breaths, and repeat.
Right.
Got it. Is the technique the same for everyone?
Right.
What about infants, for example?
Infants are much smaller and more delicate,
Right.
so we adjust our technique accordingly. The document provides specific instructions for infant chest compressions,
Yeah.
using 2 fingers instead of the heel of the hand, and the depth is shallower as well.
That makes sense.
Yeah.
We wouldn't want to apply the same force to a tiny baby.
Exactly.
Okay.
And speaking of force,
Yeah.
the document dives into the fascinating physiology behind compressions.
Okay.
It describes two main mechanisms at play, the cardiac pump mechanism and the thoracic pump mechanism.
Those sound familiar.
Yeah.
But I'd love a quick refresher.
Okay.
What do those mechanisms actually mean?
The cardiac pump mechanism is the more intuitive one.
Right.
Imagine physically compressing the heart between the sternum and the spine, squeezing blood out to the rest of the body.
Okay.
It's like manually pumping a balloon.
Okay, I can picture that.
Okay.
And the thoracic pump mechanism.
That one relies on changes in pressure within the chest cavity.
Right.
When we compress the chest, we increase the pressure inside, forcing blood out of the heart and lungs. When we release, the pressure drops, drawing blood back in.
Interesting.
It's like a vacuum effect that helps to pull blood back to the heart.
Wow, I never realized it was that intricate.
Oh, yeah.
So we're not just squeezing the heart.
Right.
We're also manipulating the body's natural pressure gradients to keep blood flowing.
Exactly.
That's incredible.
It is. The human body is amazingly resilient.
Yeah.
And the more we understand about these mechanisms, the better equipped we are to provide effective CPR.
This is fascinating.
Yeah.
And it seems like there's still so much more to learn.
Yeah.
We'll be back with more of the CPR deep dive after a quick break.
Sounds good.
Don't go anywhere.
Welcome back to our deep dive into CPR. We've already covered so much ground.
That's true.
But we're just getting started.
Yeah.
It's remarkable how many layers there are to this seemingly simple act of saving a life.
And I'm feeling a lot more confident about those chest compressions now.
Oh, good.
But I'm curious about something.
Yeah.
The document mentioned ways to assess how effective compressions are.
Okay.
PEDCO 2, coronary perfusion pressure.
Right.
These sound pretty high-tech.
They are. These are advanced monitoring tools.
Yeah.
Used mostly in hospital settings.
Okay.
To gauge how well CPR is working.
Right.
They help healthcare professionals fine-tune their efforts and ensure the best possible outcome.
Okay, so those are beyond our scope for today.
Right.
Sticking with what we can control.
Yeah.
The document then moves on to airway management.
Okay.
After those chest compressions.
Yeah.
We need to make sure the person can actually breathe, right?
Exactly. A blocked airway is like a closed door. No oxygen can get through to the lungs and the rest of the body. The document describes the head tilt chin lift maneuver as a simple but effective way to open the airway in most cases.
I remember learning that one in a first aid course.
Oh, great.
You tilt the head back and lift the chin to move the tongue away from the back of the throat.
Right.
But what if we suspect a spinal injury?
Excellent point. In those cases, we use the jaw thrust maneuver.
Okay.
It involves gently lifting the jaw forward without moving the head or neck.
Right.
Minimizing any potential risk to the spine.
Okay, so we've opened the airway.
Right.
But what if there's something visibly blocking it?
Okay.
Like a piece of food or an object?
The document suggests using the finger sweep method to remove a visible obstruction, but caution is key.
Okay.
We only attempt this if we can clearly see the object.
Yeah.
Blindly sweeping can push it further down and worsen the situation.
That makes sense.
Yeah.
It's like the old adage, look before you leap.
Right.
Now, I remember learning the Heimlich maneuver years ago.
Okay.
Does that still apply?
Absolutely. The Heimlich maneuver is a more forceful technique used when an object is completely blocking the airway.
Okay.
It involves applying abdominal thrusts to increase pressure and expel the obstruction.
It's amazing how a simple technique like that can dislodge something and potentially save a life.
It is.
And it seems like the document covers how to perform the Heimlich maneuver in different positions.
Right.
Including lying down, and for infants.
That's right.
Okay.
Because airway obstructions can happen anywhere.
Right.
And we need to be prepared to act regardless of the situation.
Right.
And as you can see, this document from London HeartbeatsZ Academy
really
is a comprehensive guide.
It really is.
If you're enjoying this deep dive, make sure you hit that subscribe button on our Facebook, Instagram, Spotify, and YouTube channels. We've got tons of fascinating content just like this.
And speaking of comprehensive, the document then moves into some more advanced airway techniques.
Right.
Face masks or pharyngeal airways, even endotracheal intubation.
Those techniques are typically used by healthcare professionals in hospital settings to establish a more secure airway, especially if basic maneuvers aren't sufficient.
Endotracheal intubation.
Yeah.
Isn't that where they insert a tube directly into the trachea?
Yes.
That sounds pretty complex.
It is a skilled procedure
Yeah.
that requires specialized training,
Okay.
and the document emphasizes the importance of verifying tube placement to ensure it's in the correct position.
Right.
They mention using clinical assessments
Yeah.
and devices like exhaled CO2 detectors.
So it's not just about getting the tube in.
Right.
It's about making sure it's in the right place
Exactly.
to avoid any complications.
Yeah.
It's all about precision.
Exactly. Every detail matters when it comes to CPR and airway management.
Right.
We've covered circulation and airway, so what's the final piece of the puzzle?
Breathing. Chest compressions circulate the blood.
Right.
But we need to make sure it's oxygen-rich blood. Right.
Yeah.
That's where rescue breaths come in.
Precisely. The document emphasizes delivering each rescue breath slowly, over about 1 second.
Yeah.
Providing enough volume to see visible chest rise.
Right.
We're aiming to mimic natural breathing as much as possible.
It also talks about different techniques for rescue breaths.
Right.
Mouth to mouth, mouth to nose.
Yeah.
And using a bag valve mask.
Yeah.
Are there certain situations where one technique is preferred over another?
Yes, the choice often depends on the situation.
Okay.
And the rescuer's comfort level and training. Mouth to mouth is the most basic technique. Yeah. But it can be challenging to maintain a good seal.
Right.
Mouth to nose might be easier in some cases.
Okay.
And a bag valve mask, often called an ambu bag,
Right.
allows for more controlled ventilation and can be hooked up to an oxygen source.
So having a variety of techniques in our arsenal
Right.
allows us to adapt to different circumstances.
Exactly.
What about supplemental oxygen?
Okay.
The document mentions that expired air
Yeah.
only contains about 16% oxygen,
Right.
which is why supplemental oxygen is ideal if available.
That extra oxygen can significantly improve the effectiveness of those rescue breaths.
Okay.
It's like giving the body a concentrated dose of what it desperately needs.
Now, I have to admit, I'm a bit intimidated by the thought of using a defibrillator.
Okay.
It seems like such a powerful, almost dangerous tool.
Defibrillation is powerful, no doubt.
Right.
It can be life-saving. But it's also important to understand when and how to use it appropriately.
The document explains that defibrillation
Yeah.
is primarily indicated for ventricular fibrillation
Right.
and pulseless ventricular tachycardia. Correct.
Those are the shockable rhythms, right?
Exactly.
Okay.
These are situations where the heart's electrical activity is chaotic and ineffective.
Right.
A defibrillator delivers a controlled electrical shock that can reset that rhythm, giving the heart a chance to beat normally again.
Okay, so it's like hitting the reset button on a malfunctioning computer.
Yeah, that's a good analogy.
Does it hurt the person?
While they're unconscious during cardiac arrest and won't feel the shock, defibrillation does carry some risks, like burns or other complications.
Yeah.
That's why it's crucial to follow the proper procedures and use it only when indicated.
The document emphasizes that the shock should be delivered within 3 minutes of the arrest.
Right.
Wow, every second counts.
It does. And thankfully, technology is on our side.
Yeah.
Remember those AEDs we talked about earlier? They're becoming more readily available in public places.
Which is a huge step forward in improving survival rates.
AEDs.
Yeah.
Those are the automated external defibrillators, right?
Exact.
The ones with voice prompts and visual cues to guide the user.
Exactly. They're designed to be user-friendly, even for someone with minimal training.
Yeah.
And as the document points out, they can even differentiate between shockable and non-shockable rhythms, adding an extra layer of safety.
That's incredible. It seems like these devices are making defibrillation much more accessible and less intimidating.
Absolutely. They're empowering bystanders to become lifesavers.
Well, this deep dive into defibrillation has definitely eased my anxieties about it.
Oh, good.
Now, the document then shifts gears and dives into drug administration during CPR.
Right.
This seems like territory for healthcare professionals.
For the most part, yes.
Okay.
Administering drugs during cardiac arrest requires specialized knowledge and training, but it's fascinating to understand the role medications play in this process.
The document lists several methods for delivering drugs during CPR, including peripheral, interosseous, and endotracheal.
Right.
What do those mean?
These different routes allow healthcare professionals to get those life-saving medications into the system as quickly as possible.
Right.
Peripheral 5-D access is the most common. but sometimes other routes.
Yeah.
Like intraosseous injecting directly into the bone marrow are necessary.
It's amazing how resourceful medical teams can be
Yeah.
in these critical situations.
It is.
The document then outlines various medications used during cardiac arrest, starting with vasopressors, like epinephrine and vasopressin.
Vasopressors are like the body's own adrenaline rush. They help constrict blood vessels, increasing blood pressure and improving blood flow to vital organs during cardiac arrest.
So they're like giving the circulatory system a much-needed boost.
Exactly. Epinephrine is a classic example. It stimulates the heart, increasing its rate and force of contraction. It also helps constrict blood vessels, ensuring more blood reaches those vital organs. It's a powerful tool in the fight against cardiac arrest.
And then there's vasopressin. What's its role?
Vasopressin is another vasoconstrictor, particularly effective at tightening those blood vessels. It's especially helpful in cases where low blood pressure doesn't respond well to epinephrine. It's like having a backup plan for when the body needs an extra push.
It's incredible how these medications can work in tandem.
It is.
To support the body during such a crisis.
Yeah.
The document also mentions antiarrhythmic drugs like amiodarone, lidocaine, and magnesium.
Antiarrhythmic drugs are the rhythm regulators. They help suppress those abnormal heart rhythms.
That can be a contributing factor or a consequence of cardiac arrest.
Yeah.
It's all about getting the heart back into a steady, effective beat.
So they're like the conductors of the heart's orchestra, making sure everyone's playing in sync.
I love that analogy.
Thanks.
You're really getting the hang of this.
Amiodarone seems to be the go-to drug for certain life-threatening arrhythmias, like ventricular tachycardia, while lidocaine might be used if amiodarone isn't available. And magnesium steps in specifically for a type of irregular heartbeat called torsades de pointe.
Exactly. Each drug has its own unique role and indications, allowing healthcare professionals to tailor the treatment to the specific situation.
It's like having a toolbox full of specialized tools, each designed for a particular task.
Precisely. And that's a hallmark of good medicine, having the right tools and the knowledge to use them effectively. So we've explored the immediate steps of CPR and the medications used during cardiac arrest. But the document goes deeper, doesn't it?
It does.
It dives into the potential underlying causes of cardiac arrest.
You're right. Treating the immediate problem is crucial. But we also need to understand why it happened in the first place. The document outlines the 5 H's and 5 T's as potentially reversible causes of cardiac arrest. It's like a detective's checklist for uncovering the root of the problem.
The 5 H's and 5 T's?
Yeah.
That sounds familiar. Can you remind me what those stand for?
Of course. The 5 H's are hypovolemia, hypoxia, hydrogen ion, acidosis, hyperkalemia, and hypothermia.
Wow, that's a lot to unpack.
Yeah.
Can you get those down for me?
Certainly. Hypovolemia means low blood volume, which can be caused by things like severe bleeding or dehydration. Hypoxia refers to a lack of oxygen, which could be due to airway obstruction, lung disease, or even drowning.
Wow.
Hydrogen ion, or acidosis, indicates an imbalance in the body's pH, often caused by conditions like diabetic ketoacidosis. Hypokalemia refers to abnormal potassium levels, which can disrupt the heart's electrical activity. And hypothermia, low body temperature, can slow down all bodily functions, including the heart.
So the 5 H's are all about things going out of whack within the body itself.
Exactly.
What about the 5 T's?
The 5 T's encompass external factors that can trigger cardiac arrest. They are toxins, tamponade, tension pneumothorax, thrombosis, pulmonary, and thrombosis. Coronary.
Wow, another mouthful. Can you elaborate on those?
Of course. Toxins can include drug overdoses, poisons, or even certain medications. Tamponade refers to a buildup of fluid around the heart, squeezing it and preventing it from filling properly. Tension pneumothorax occurs when air leaks into the space between the lung and chest wall, collapsing the lung and putting pressure on the heart. Pulmonary embolism, a type of thrombosis, is a blood clot that travels to the lungs,
Right.
blocking blood flow,
Okay.
and coronary thrombosis.
Mm.
A blood clot in the arteries supplying the heart
Yeah.
can lead to a heart attack.
It's fascinating how such a diverse range of factors
Yeah, it is.
can contribute to cardiac arrest.
It is.
It's a reminder that the human body
Yeah.
is this incredibly complex system.
Right.
And when one part goes wrong,
Yeah.
it can trigger a cascade of events.
Exactly. Understanding these potential causes is crucial
Okay.
for both preventing cardiac arrest
Yeah.
and providing effective post-resuscitation care.
Okay.
Speaking of which, that's where the document goes next.
Right.
Post-cardiac arrest care.
So even after the heart restarts, the work isn't over.
Not at all.
Okay.
Post-cardiac arrest care is all about optimizing recovery
Mm.
and minimizing long-term complications.
Right.
It's about giving the patient the best possible chance
Yeah.
to regain their full health and function.
The document emphasizes avoiding fever
Yeah.
after cardiac arrest.
Mm-hmm.
Why is that so important?
Fever increases the brain's metabolic demands at a time when it's already vulnerable
Yeah.
after a cardiac arrest.
Okay.
It's like asking someone to run a marathon after they've just sprinted a mile.
Okay.
We want to give the brain the best chance to recover.
Right.
And that means keeping things cool.
It also discusses therapeutic hypothermia,
Right.
which seems counterintuitive.
Yeah.
Intentionally cooling the body down.
It might seem strange,
Yeah.
but research shows that carefully controlled cooling can actually protect the brain after a cardiac arrest.
Okay.
It's like putting the brain on pause while the body recovers.
That's fascinating.
It is.
The document outlines how hypothermia is induced and maintained, typically for 12 to 24 hours.
Right.
And it mentions potential complications,
Yeah.
like hyperkalemia and hyperglycemia.
Yeah.
Are those common?
They can occur as the body rewarms.
Yeah.
So healthcare providers are vigilant in monitoring and treating them.
Right.
It's all about managing those delicate balances within the body
Yeah.
during recovery.
Okay, so temperature control is crucial.
Right.
What else does post-cardiac arrest care involve?
Glycemic control is another important aspect.
Okay.
The document recommends aiming for moderate glucose levels, avoiding both hyperglycemia and hypoglycemia.
Right.
Too much or too little sugar in the blood
Okay.
can hinder recovery.
It's all about finding that sweet spot, so to speak.
Exactly. And the document also stresses the importance of treating hypotension,
Yeah.
low blood pressure,
Right.
which can be a common issue after cardiac arrest. Low blood pressure can compromise blood flow to vital organs. So maintaining adequate perfusion is critical.
So post-cardiac arrest care is this multifaceted, ongoing process
Yeah.
that extends far beyond the immediate resuscitation efforts.
It is.
Okay.
It's a team effort
Yeah.
involving healthcare professionals from various disciplines,
Right.
all working together
Okay.
to optimize the patient's recovery.
This document is really highlighting the holistic nature of CPR.
It is.
It's not just about restarting the heart.
Right.
It's about addressing the underlying causes,
Yeah.
providing optimal care during those crucial moments, and supporting the patient's journey to recovery.
Exactly.
It's truly remarkable.
It is. And speaking of remarkable,
Yeah.
the document then shifts gears
Okay.
and talks about the ACLS cardiac arrest circular algorithm.
Okay.
What are your initial thoughts on this? It seems a bit more technical.
Honestly, algorithms make me a bit nervous.
Oh, yeah.
They seem so rigid and inflexible.
I understand, but this algorithm is actually quite dynamic. It's not a set of strict rules,
Right.
but rather a visual representation of the steps involved in managing cardiac arrest.
Okay.
It emphasizes the cyclical nature
Yeah.
of assessment, intervention, and reassessment.
So it's not just about following a linear path,
All right.
but rather about constantly evaluating the situation
Exactly.
and adapting the approach as needed.
Exactly. It's a continuous loop.
Okay.
Assess the patient's condition, take appropriate actions,
Right.
and then reevaluate to determine the next steps.
Yeah.
It's about being responsive
Yeah.
to the ever-changing dynamics of cardiac arrest.
That makes a lot more sense.
Yeah,
It's like a feedback loop, constantly adjusting
exactly.
based on the patient's response to treatment.
Yeah.
Now, the document goes on to highlight the differences
Okay.
between pediatric and adult resuscitation.
Right.
What are some key things to keep in mind
Okay.
when dealing with children?
Children have unique physiological differences. That necessitates adjustments to CPR techniques.
Right.
For infants, for example,
Yeah.
we use 2 fingers for compressions
Okay.
instead of the heel of the hand.
Right.
And the compression depth is shallower. We're always mindful of their smaller size and fragility.
It's like handling a delicate flower.
Yeah,
We need to be gentle, yet firm in our approach.
that's a beautiful way to put it.
Thanks.
The compression rate remains the same,
Okay.
at least 100 per minute.
Yeah.
But the compression to ventilation ratio varies,
Okay.
depending on the age of the child
Right.
and the number of rescuers involved.
So there's a bit more nuance to pediatric CPR,
Yeah,
but the core principles remain the same.
exactly.
High-quality compressions
Mhm.
and effective ventilation.
Exactly. And speaking of nuances,
Okay.
the document then discusses modifications to CPR for pregnant women.
Oh, okay.
What are your thoughts on this?
Honestly, I hadn't even considered that
Yeah.
pregnancy might require adjustments to CPR. What are some key things to keep in mind?
Pregnancy brings about significant anatomical and physiological changes,
Right.
so we need to adapt our approach.
Oh, I?
Positioning is crucial.
Yeah.
The document recommends a left lateral tilt
Mm.
to improve blood flow to the heart.
Why the left side specifically?
This position helps relieve pressure on the inferior vena cava,
Okay.
a major vein that carries blood back to the heart
Right.
in later pregnancy.
Yeah.
The weight of the uterus can compress this vein
Mm-hmm.
when the woman is lying flat on her back,
Okay.
hindering blood flow.
Right.
Tilting her to the left helps alleviate that pressure.
That makes a lot of sense.
Yeah.
It's like creating a detour for the blood to flow more freely.
Exactly. And the document also mentions performing chest compressions,
Okay.
slightly higher on the sternum,
Mhm.
and the importance of early airway management to
Yeah.
prevent aspiration.
Oh.
These adjustments help minimize the risk of complications
Right.
for both the mother and the fetus.
It's amazing how CPR can be tailored to these specific situations.
Yeah, it is.
It really highlights the adaptability and ingenuity
It does.
of this life-saving technique.
It does. And speaking of adaptability,
Oh.
the document then delves into the evolution of CPR guidelines,
Okay.
highlighting some key updates that reflect the latest scientific evidence.
Right.
What are some of the changes that stand out to you?
Well, the shift from ABC to CA
Yeah,
seems significant.
it is.
It prioritizes chest compressions,
Right.
recognizing that restoring circulation
Yeah,
is often the most critical initial step.
exactly. It's about streamlining the process
Right.
and focusing on the actions
Yeah.
that have the greatest impact in those first crucial moments.
Mhm.
The document also mentions the removal of the look, listen, and feel step,
Right.
which was once considered standard practice.
I remember learning that step years ago.
Oh, wow.
But I guess it makes sense
Yeah.
to eliminate any hesitation or delay in providing those life-saving interventions.
Exactly.
We trust the signs.
Yeah.
Unresponsiveness and absent or abnormal breathing,
Right?
and act accordingly.
Exactly.
Every second counts.
You've got it.
Yeah.
And speaking of seconds,
Yeah.
the document also highlights an emphasis
Okay.
on higher chest compression rates.
Okay.
Why do you think that changed?
Well, if faster compressions
Yeah,
can improve blood flow and survival,
right.
then it's a no-brainer. Right?
Exactly.
It's all about fine-tuning those techniques
Yeah.
to maximize effectiveness.
Precisely. And the recommendations for chest compression depth have also been updated,
Right.
emphasizing at least 2 inches for adults.
Right.
Studies have shown that adequate depth is crucial
Yeah.
for generating enough force to circulate blood effectively.
Okay.
It's about making sure those compressions are truly making a difference.
It's amazing how research
Yeah.
continues to refine our understanding of CPR and lead to these evidence-based updates. It's a testament to the dedication of the medical community
It is.
to constantly improving patient care and outcomes.
It is. And speaking of research,
Okay.
the document then tackles
Yeah.
a somewhat controversial topic,
Okay.
cricoid pressure.
Cricoid pressure.
Yeah.
Wasn't that once routinely recommended
It was.
to prevent aspiration during rescue breaths?
Yes, it was.
Okay.
But recent evidence has questioned its effectiveness
Right.
and even highlighted potential drawbacks.
Okay.
The new guidelines don't recommend routine use of cricoid pressure,
Right.
acknowledging that it can hinder airway management and
Yeah.
may not reliably prevent aspiration.
It's interesting how long-held practices can change.
Yeah, It is.
as new research emerges.
It is.
It shows that the medical community is constantly evaluating and reevaluating its approaches based on the latest evidence.
Absolutely. And that's a good thing.
Yeah.
It means we're always striving to provide the best possible care based on what we know.
Okay. What other updates does the document highlight?
The new circular ACLS algorithm is another significant change. It emphasizes that continuous loop we talked about. Assess, intervene, reassess, promoting a more dynamic and adaptable approach to cardiac arrest management. Moves away from that rigid linear algorithm. Recognizing that cardiac arrest is a fluid situation that requires ongoing evaluation and adjustment.
It's a more realistic representation of how healthcare professionals actually manage cardiac arrest in real-world settings.
Exactly. It's about being responsive and adaptable. And speaking of responsiveness, the document highlights the expanded role of capnography in monitoring CPR quality. Capnography, which measures the amount of carbon dioxide in exhaled breath. Provides valuable information about the effectiveness of ventilation and circulation during CPR.
So it's like having a real-time gauge of how well those rescue breaths are working.
Exactly. The guidelines now recommend continuous waveform capnography for intubated patients throughout the peri-arrest period. This continuous monitoring helps healthcare providers optimize ventilation settings and assess the overall effectiveness of resuscitation efforts.
It's amazing how technology is providing us with these incredible tools to fine-tune our approach to CPR and improve outcomes.
It is. And as technology advances, I'm sure we'll see even more innovations in the field of cardiac arrest care. Now, speaking of innovations, the document then delves into alternative techniques and devices for CPR. What are your initial thoughts on this section?
Honestly, I always thought CPR was pretty straightforward. But this document is really opening my eyes to the complexities and the constant evolution of this life-saving technique. I'm intrigued by the idea of alternative approaches, but also a bit wary.
I understand. It's important to remember that conventional CPR remains the cornerstone of cardiac arrest management. But there are situations where alternative techniques or devices might be considered, especially when prolonged CPR is required or additional support is needed.
The document emphasizes that rescuers should be properly trained in these alternative approaches. And that minimizing interruptions in chest compressions and defibrillation remains paramount. So these alternatives should complement, not replace, conventional CPR.
Exactly. They're like specialized tools in a doctor's bag. We use them strategically when the situation calls for it. The document describes several techniques, including high-frequency chest compressions, open chest CPR, interposed abdominal compression CPR, cough CPR, prone CPR, and the precordial thump.
What are your initial reactions to these?
Well,
some of those names sound pretty intimidating. High-frequency chest compressions. Is that like super fast compressions?
Essentially, yes. It involves delivering compressions at a faster rate than conventional CPR. This technique may be considered in certain situations where conventional CPR is ineffective, but further research is needed to confirm its benefits.
Open chest CPR sounds pretty intense.
It is.
What is that all about?
That's a more invasive procedure that involves directly compressing the heart through a surgical incision in the chest. It's typically reserved for very specific situations, like cardiac arrest during surgery or in the immediate post-operative period after cardiothoracic surgery.
So that's definitely not something a bystander would ever do. What about cough CPR? I remember we touched on that earlier.
Cough CPR is a self-administered technique. Primarily applicable in controlled settings, like a cardiac catheterization lab, where the patient is conscious and monitored. It involves the patient forcefully coughing every 1 to 3 seconds to maintain some blood flow during the initial moments of cardiac arrest. Again, not something you'd try on someone who's unresponsive.
And then there's prone CPR. That's performing CPR with the person lying on their stomach.
Correct.
When would that be used?
Prone CPR might be considered when turning the person onto their back isn't feasible or safe. Like if someone experiences cardiac arrest while strapped to a spinal board, after a trauma.
The document also mentions the precordial thump,
Yes.
which sounds a bit like something out of a movie.
Yeah.
What is that?
It's a technique involving a sharp blow to the chest.
Right.
And it might be considered
Oh,
for
okay.
certain types of unstable ventricular tachycardia
Mm.
if a defibrillator isn't immediately available.
Okay.
However, it's important to note that the precordial thump should not delay conventional CPR or defibrillation.
Okay, so we've covered these alternative CPR techniques,
Right?
which are intriguing,
Yeah,
but clearly have specific indications and limitations.
exactly.
The document also discusses devices that can assist with ventilation and circulation during CPR, right?
That's right.
Okay.
These devices can be valuable tools for healthcare providers, especially when prolonged CPR is required
Right.
or when additional support is needed.
What are some examples of these devices?
Automatic transport ventilators,
Okay.
or ATVs,
Yeah.
can provide consistent ventilation,
Right.
freeing up rescuers to focus on other tasks like chest compressions.
Okay.
They're particularly useful in pre-hospital settings
Right.
or during transport.
So it's like having an extra pair of hands to help with breathing.
Exactly. Then there's active decompression CPR,
Okay.
or ACD CPR, which uses a suction cup device to actively lift the chest.
Right.
During the decompression phase of CPR, this technique aims to enhance venous return and improve blood flow.
It's like giving the chest a little extra help to recoil,
Yeah,
ensuring the heart refills properly between compressions.
precisely.
Yeah, okay.
And finally, there are impedance threshold devices,
Right.
or ITDs,
Okay.
which are valve-like devices that attach to the airway and limit airflow during the decompression phase of CPR.
Okay.
They also aim to improve venous return and cardiac output
Right.
by creating negative pressure in the chest.
It seems like all these devices, while impressive, are really just tools to enhance conventional CPR.
Conventional CPR,
Yeah.
with its focus on high-quality chest compressions and effective ventilation,
Right.
remains the foundation of cardiac arrest care.
Okay.
But these alternative techniques and devices represent ongoing efforts to refine and enhance our approach,
Right.
constantly striving for better outcomes.
It's incredible to see how much research and innovation is dedicated to this field.
Yeah, it is.
It's a testament to the importance of CPR and its potential to save lives.
Absolutely. And speaking of saving lives,
Yeah.
the document then wraps up
Okay.
with a powerful message, emphasizing that early recognition,
Right.
prompt activation of the emergency response system,
Yeah.
and high-quality CPR
Okay.
are the most critical factors in improving survival.
Okay.
What are your final takeaways from this section?
It's a powerful reminder that we all have the potential to be lifesavers.
That's right.
By understanding the signs of cardiac arrest,
Yeah.
knowing the basics of CPR,
Right.
and acting quickly and decisively, we can make a real difference in those critical moments.
Beautifully said. And this deep dive into CPR, courtesy of the amazing resources from London HeartbeatsZ Academy, UK,
Right.
has hopefully equipped you with the knowledge and confidence to do just that.
It truly has been an eye-opening experience. I feel like I've gone from CPR novice to feeling somewhat empowered, at least in terms of understanding the core concepts.
Right.
And the importance of being prepared.
And that's what it's all about.
Yeah.
Knowledge is power, especially when it comes to something as vital as CPR.
Right.
The more people who understand these concepts, the more lives we can potentially save.
Okay.
And speaking of saving lives,
Yeah.
if you're finding this discussion valuable, be sure to subscribe to our channels on Facebook, Instagram, Spotify, and YouTube.
Got it.
You won't want to miss our future deep dives.
Absolutely. This deep dive has been incredibly informative and inspiring.
Oh, good.
We've covered so much ground,
Yeah.
from the basic principles of CPR to the latest scientific advancements and the critical role we can all play in those moments when every second counts.
It's been a privilege sharing this journey with you.
And to our listeners,
Yeah.
we hope you found this deep dive as fascinating and empowering as we did. We encourage you to seek out additional training and resources, such as those offered by London HeartbeatsZ Academy, UK,
Yes.
to become even more confident in your CPR skills.
Remember, this is just the beginning.
Yeah.
The more we learn and practice, the better equipped we are to make a difference when it matters most.
Stay curious, stay informed, and who knows, you might just save a life someday.
That's right.
That's a wrap for our deep dive into CPR.
Okay.
And a huge thank you again to London HeartbeatsZ Academy UK
Yes.
for the excellent educational material.
Great.
We'll be back soon.
Okay.
So make sure you're subscribed to our channels, Facebook, Instagram, Spotify, and YouTube,
Right.
to catch the rest of this essential knowledge.
Sounds good.
See you then.